Thank you for joining me. My name is Tavrakis, and I'm an oncology social worker with the Henry Ford Cancer Institute. The topic is coping with the fear of cancer recurrence. So, over the past few months and weeks, our world has changed. We've been asked to adjust and sacrifice to protect ourselves, our loved ones, our community from a global health threat. Many of us are experiencing a vulnerability that cancer patients may already know. Before this pandemic, those otherwise healthy didn't think twice about the sniffles or a cough, and now those symptoms are sounding alarms. For many cancer patients, any new physical symptom may trigger anxiety. The fear that cancer may continue to affect their lives may be an ongoing struggle. Coping with fear has become a timely topic for everyone, but especially those with a cancer diagnosis. Patients may worry about the added risk of infection from chemotherapy. They may also face a greater uncertainty about potential delays or disruptions in care. While no one can predict the exact course of the coronavirus pandemic, here at the Henry Ford Cancer Institute, we are doing everything possible to ensure the safety of our patients and to provide the best possible care. We are all in this together, and we're here to support our cancer community. So please call your care team, join our Facebook group, visit our website for resources and information. Please stay connected to us during this time. Courage, hope, faith, resilience, a healthy blend of realism, optimism, acceptance, a dash of defiance. These are the ways cancer patients have faced fear and overcome adversity. There's a lot to be learned. Hopefully, this talk will offer some additional tips and resources for handling fear surrounding cancer. And let me just start by saying that despite all our advances, having cancer can still be scary. It's normal to worry about how cancer may affect your life now as well as in the future. So let's just start by going over some cancer terms that may be helpful for this talk. Cancer remission is a common term in cancer care. With complete remission, there's no visible signs or symptoms of cancer after treatment. In partial remission, there's a response to treatment, but some cancer can still be detected. When we talk about a cure, we mean that there's no traces of cancer after treatment, and the cancer will most likely not come back. For some cancers, a cure is certainly possible. You may hear that the intent of treatment is curative, which means that we're aiming for a cure, but we may need to wait to be sure. So if you remain in complete remission for 5 years or more, some doctors will say that you're cured or cancer-free. Recurrence is a reason why oncologists will say remission as opposed to cure, especially right after treatment. So recurrence is when the cancer cannot be detected after you've completed treatment, but then it comes back. And recurrence can happen in the same spot, the same area, or different part of the body. So recurrence can be local, regional, or distant. With all cancer treatments, we're always hoping for a cure, but this may not always be possible. So for advanced cancers, the goal is remission and controlling the cancer. So when an existing stable cancer grows, spreads, or gets worse, that's called progression. In the case of chronic cancers, recurrence and progression can have similar meanings. Depending on the type of cancer and staging, fear of recurrence may mean something slightly different. So to be inclusive, let's define it as the fear or worry that cancer will return, progress, or that a new cancer will appear. Let's jump into how we can best cope with fear and uncertainty. Perhaps it's easier said than done, but lessening worry is certainly possible. So here are some tips. Recognizing or being mindful of your emotions and how they may affect your thoughts, your relationships, and just how you go about your day can be helpful. If you worry a lot, burying or fueling those fears may make them worse. It's important to find a healthy way to cope. And hopefully that's what we'll be discussing here in this talk. Don't worry alone. Alone our mind can magnify or repeat our worries over and over. Talking to someone can help us move to a different, better place. Now more than ever, having a routine is so important. Having a purpose and knowing what you're going to do when you wake up each morning and sticking to it will help you center yourself. While we can control all negativity and negative thinking, being able to channel it through creativity, exercise, work, or other outlets can certainly change our outlook. And with everything that's going on, to some degree, we all may feel like we're on an emotional roller coaster. Overwhelming feelings can happen, but they also can pass. And knowing how to weather that storm can be helpful in keeping you safe and focused. When there's an end or break from treatment, some patients describe having conflicted, strong emotions. Relief, anxiety, hope, uncertainty can all get tangled together. Of course, everyone is different, but all patients should know what comes next. So, a survivorship care plan is a record of your cancer and treatment history, and also your checkups and follow up tests that you need in the future. And unfortunately, some cancer treatments have physical and emotional side effects. Recognizing them, not confusing them with something worse, and what can be done to help are things that you should know and should be included in your survivorship care plan, along with resources for keeping healthy. And also, if your treatment is ongoing, it may be a good idea to discuss your care plan with your doctor. And it's also helpful to know not all aches and pains equal cancer. And that's really a great segue to our next slide. So, when you do return to see your oncologist, here's just some tips. Talk about any symptoms that you may be having. There may be ways to help and also for you not to worry. Know your comfort level with information. Oncologists should be both honest and hopeful. Some information is essential, but think about how much detail you want about your exact risk of recurrence. And just two things to remember: no one has a crystal ball. And while there's a lot of statistics about cancer, you're more than that statistic. And your risk is also based on factors that are unique to you and your cancer. It's really best to talk to your doctor. And it's also important, especially if you're going over scans, to bring somebody with you. It's helpful to have that other set of eyes and ears, and also to take notes so that you have something in writing to reference after. There'll also be an after visit summary, which can be helpful in detailing some aspects of your visit. So, a colleague of mine introduced me to this term scan anxiety, and it's really, that anxiety that pops up around the time of your scans, and it's temporary, but it can be pretty powerful at times. Um, and here's just some tips that can help. It's a good idea, just like when you go to the doctor, when you're going for a scan, have somebody with you, have some companionship, and whether you have somebody or not, it's always a good idea to have a distraction, a book, a tablet, music, something for the waiting room. And it's always good to be kind to yourself, but especially before and after the scan while you're waiting for those results. Some people like to stay busy, others like having support, and some people just need that space to just be. It's helpful to know what works for you. It's also important to remember that not all treatments will involve having scans after it's completed. So not having scans can also cause anxiety. Talk to your doctor about how to best monitor your risk of cancer recurrence. So here's that $1 million question. Can I prevent cancer from returning or spreading? And it's a common question, and I'm not sure a yes or no answer will do it justice. So what I would say is focus on what you can control. If there's one thing you do have control over, is completing your treatment. Some treatments can be ongoing, and they can last a long time. With hormone therapies, um, people can be on those for 5, 10 years. And what I would say is if you're having any side effects, if you're thinking about stopping, before you do, please talk to your doctor. There may be things that can help. Also, try not to panic or be in denial about having have had or living with cancer. Um, Focus on what you can do to stay healthy, and I would pray that the cancer would never return or progress. But if it does, the sooner we can detect it, the better the outcome. So stay current with your follow-up and your surveillance. Also, along those same lines, alert your doctor about any health changes. Many things about cancer returning or even getting cancer in the first place are they're outside of our control. So blaming yourself is not helpful, and it's not necessarily realistic. And regardless of how healthy you were or were not, before your diagnosis. It's never too late to make healthy choices and improve your health. So speaking of healthy lifestyle, what I would say is, really stick to the basics. Reduce stress, get a good night's sleep, maintain a healthy diet, stay connected to others, practice good mental and physical self-care, and surround yourself with people and things that you enjoy. And with the social distancing, um, you may need to find some creative ways of staying active and connected, even with friends and family, especially those not currently living with you. But even with those that you're sharing a space, um, this could be a chance to reconnect as well. And if there's any silver lining in this pandemic, it's really forcing people to slow down and really think about who and what matters most in their lives. Speaking of support, um, finding and giving support, especially during this time, can really be a game changer. The Henry Ford Cancer Institute Survivorship Facebook group is available to all cancer patients, and it's a wonderful way to connect. The caring and support that happens in this wonderful virtual community is truly incredible. Colleen's Corner is part of our website, and it's available to our cancer patients and survivors and contains a wealth of information and resources on cancer-related topics. And Game on Cancer, that's my baby. It's our charity, and it's what helps so many of our patients in need. And we encourage patients who are able to give back to do so. Game on Cancer exists because of everyone's support and donations. So it's just a wonderful thing if you can be a part of it. So hopefully live programming will be back through the Henry Ford Cancer Institute. But in the meantime, we are offering some virtual options. So through our Facebook group, there's just some added weekly programming that has now been included, and it's really wonderful. So we have Movement Monday, which brings information from our exercise physiologist, Ashley Betzer. There's videos, articles, resources that are going to be shared. Therapeutic Thursday offers virtual art therapy and meditation, and Food Friday has delicious recipes and diet information. So just some wonderful things that are happening to our Facebook group and some virtual programming to get us through these times. The other group I wanted to just talk about is Immerman Angels. Immerman Angels connects cancer patients and caregivers to supportive survivors with similar cancers and experiences. The one-on-one connection with someone who has already been there, and they can provide an understanding, support, and practical advice, based on experience. It's so valuable. Immerman Angels is offering virtual ways to connect also now. And if you need a mentor, if you're looking to mentor somebody as a way to give back, please contact Immerman Angels. They're a wonderful, wonderful organization and do some great work. So we talked about that emotional storm, and most people, for most people, it can pass. They have the inner strength, the supports, the resources, to get through that tough time. But what if that tough time doesn't go away? What if you find yourself that you're still consumed with worry, you're overwhelmed with emotions, and they're affecting your daily activities, your relationships, your self-care? We talked about that panic um, or that denial. So if you're avoiding or overscheduling appointments, you're not following medical recommendations, those can be flags that you could benefit from professional help. And of course, if you're having any thoughts of harm, by all means, you need to reach out to us right away. We're here to help. We offer psych-onc services. We're currently offering them through telemedicine. And so there's a virtual way to connect with a wonderful clinician who will be able to help. And just some takeaway thoughts. Understand what you do have control over when it comes to your cancer. Use your energy to focus on what you can do now to stay as healthy as possible. Learn about the services available to you and your loved ones. Enjoy the moment rather than thinking of an uncertain future or a difficult past. And there's just been a lot of statistics thrown at us with the coronavirus. And They're important. We need them. But it's perhaps been hard, and hopefully things, we're going to see that shift in a positive direction if we're not already. But I wanted to share some really positive statistics here. So since 1974 into the present and projecting into the future, more and more people are living with cancer. And it's not because cancer is becoming that much more prevalent, or more people are getting cancer. It's because people are being cured, they're being treated, people are living with cancer much longer. And it's just important to remember cancer is now more treatable than ever. So I wanted to end on some good news. And also I wanted to just offer some concluding remarks that are not my own, but actually come from Dr. Morhab Al-Ajkar, who's a family physician and a faculty member at the University of Washington. He wrote this wonderful article for NPR, and it truly just captures eloquently the unique perspective that cancer patients offer during this difficult time. And I'll just offer some hope and encouragement. So I thought I would share it with you. This epidemic reminds us that no one is immune from illness. When we are busy trying to survive individually, let's not forget the other person, and especially let's not forget those who have been ill for a while. As our society faces an illness that is serious and devastating, we, cancer patients, can share a few lessons from dealing with our infirmities. With support and care, we can find the strength to carry on. You keep going, and you give it your best shot. And always try to remember today is a gift. And this is my team. These are my colleagues, and I couldn't be blessed to work with such incredible people. Many of them helped me with this presentation. This was truly a team effort. So I just wanted to thank them and just share this picture of them with all of you. I just can't say enough. So thank you for joining me. Please stay safe and please stay connected with each other and with us. We're here to help you here at the Henry Ford Cancer Institute. So thank you so much.